All right, this is module 2 on health promotion and health and wellness. We're going to be focusing on those topics along with Healthy People 2020. So what is health promotion? Why do we care about health promotion? So according to the World Health Organization, the WHO, is health promotion is the process of enabling people to increase control over and to improve their health. Now, if you go to, I want you to think about this as we're learning about health promotion, the different levels, and the prevention that we do as nurses and how we implement that in our practice. I want you to think about your own lives for a moment. On page 911 in your F.A. Davis book, The Basic Nursing, it has a really great kind of like a critical thinking question. So it's meet your peer. So it's talking about how you're in your first nursing course. That's you guys. You guys are in your first semester here. So when it's talking about how you have classwork to do, you spend a lot of time studying, you spend a lot of time writing papers, and then you have non-nursing coursework, and then you also, a lot of you guys are parents. And if you're not parents, you have a job. And even, like a lot of you could be parents, have a job, have family, okay, and friends. So you have a life outside of school, right? We all do. So, and you're only getting like what? How many hours of sleep are you really getting? Maybe 4 to 6 hours a night. And what are you eating nowadays? Are you doing what you normally have been doing? Are you snacking at that vending machine? Or are you sticking with your meal plans while you're in this program? So it asks some good questions here. It says, given your current lifestyle, do you consider yourself healthy? Think about it. Now, think back in Module 1 for 215, the functions and roles of a nurse, and they play a role in our health so much. Now, the reason why I bring this up is kind of just to put this in your head. Always think of this. You have to have self-care, right? And then we're talking about health promotion. Not only does this pertain to our patients, this pertains to us as well. We have to take care of ourselves. That when we get into practice, when you are in class, that you are taking the time for yourself. You can't study 40 hours a week, all right, and not do something fun. You have to do something you enjoy each week. That's my soapbox on that. So let's continue. So there's different levels of prevention. So what are the levels of prevention? There is primary, secondary, and tertiary levels, and we're going to break them down. So what is primary prevention? It addresses the needs of healthy clients to promote health and prevent diseases. So it decreases their risk. So let's see, what can you think of? Primarily, it's a lot of education. So there's car seat education. There's nutrition education. Talk about what type of healthy foods to eat. Exercise education, 30 minutes a day. Okay, just 30 minutes a day, even if it's walking, just exercise education. Health education in schools, that's primary prevention. So that includes sexual transmitted diseases, nutrition education, helmet and bike safety education in schools, wearing sunscreen. Why do I care about sunscreen? Think about the diseases that could come from not wearing your sunscreen. Now, just educating on a client that we're doing the primary prevention. We are educating them on wearing sunscreen for protection against skin cancer, skin abnormalities because they may have discoloration. Immunization. Okay, that's a big thing. So the measles outbreak, it was just at, what's that mall called? It's the one at Mesa, the Arizona Mills. They had those measles outbreak. There was people there who had measles and they were walking around the mall. So education is huge in primary prevention. All right, so we're trying to prevent onset of diseases or problems. So let's talk about the immunizations. There's something called the herd immunity and this is how it works. So the yellow is the vaccinated patients, all right, or population. The baby blue is the unvaccinated, and then the dark blue is the infected. Now, looking at this, the percentage vaccinated on the right lower corner is 95%. It's primarily yellow. But then it started to see a downtrend in that color. So then you see a lot of blue coming in. Now, those patients who are unvaccinated and then patients, or not, I don't want to say patients, but the population that's unvaccinated and then people who are infected, the people who are unvaccinated, they're at a bigger harm. And plus for patients who are vaccinated. Now, let's talk about measles and vaccination. Now, let's just primarily really talk about all vaccinations. I want you to put yourself in these shoes. You're a nurse in the emergency department. You have a child who's coming in with a rash. They have a fever, they have a cough, they have the signs and symptoms of possibly measles. All right. So they have a cold as well. There's a lot of things going on. You ask the mom, and this is something you ask most of your patients, is are you up to date on the vaccinations, especially for children? Mom goes, no, we don't vaccinate. Okay, well, what's my responsibility as a nurse? Right there. What do you think? Now, think realistically. I know a lot of you just kind of want to go gun-ho and go, well, I'm going to tell her she's doing it wrong. Or you might think that. Now, am I really going to say that to the mom? No, I'm not. Because what am I going to do? I'm going to make her lose that trust in me. She's not going to want me to help her and her son or daughter. Not at all. So, how are we really going to approach this parent? I want you to think about that, and we're going to talk about it in class. And then look now and create little arguments for pro-vaccination and who are con-vaccination. What is the argument for each? And we're going to talk about it. So let's go into secondary. So this involves the screening activities and education for detecting illnesses in early stages. So activities to prevent a worsening health status. So let's back it up though. Primary prevention is designed to prevent or slow the onset of diseases. So now secondary, we are doing activities to prevent a worsening health status. So what are some examples? Breast exams, regular breast exams. So people who are under 39, they get it every 3 years, and people over 40 will do it annually. Routine physical exams. This is annual. Hearing screening. A lot of our older clients will get this as well. BMIs. Okay, how is their weight? Dental exams every 6 months. Foot checks in diabetics. This is a daily check that they have to do. Early detection and treatment of diabetes mellitus. So that includes doing foot checks. That's include doing a blood test that's called hemoglobin A1C. So it detects to see, okay, well, this patient, let's say they have thyroid issues and they're unable to lose weight because they have hypothyroidism. Then this could be for males or females. So this patient is unable to lose the weight, so then they're at high risk for being pre-diabetic. So to determine if they are pre-diabetic or if they're diabetic, they're going to do a hemoglobin A1C. Okay, so you'll learn about that a little bit more. Exercise programs in frail older adults. Now, when patients come into the ED, we have a lot of patients who have high blood pressure and they don't take any medicines. So in their discharge paperwork, we always recommend when they go to their primary that they get a follow-up on their blood pressure. So blood pressure checkings is in here as well. How about TB skin test? Absolutely. It is a secondary prevention. Now, what is tertiary? So tertiary is focused on stopping the disease from progressing or returning. So we're trying to support these clients to have optimal functioning. This begins after an injury or an illness. So what do you think is the main intervention during this level? What is the main intervention that we're going to do? Rehab. They're going to rehab. So let's possibly prevention of pressure ulcers after a spinal cord injury as well. Promoting independence after a traumatic brain injury, a TBI. And referrals to support groups. This is all tertiary prevention. We're going to do this one in class, but you're welcome to view it before we come to class. Now, Healthy People 2020. This is the last year for Healthy People 2020. So what is it? It's to promote health and prevent disease nationally, so for the entire nation. So it's a collaborative effort among the local government, professional organizations, and individuals. What are some examples of at-risk populations? What are some at-risk populations we have even in our nation? The poor, the elderly, ethnic minorities, people who have economically disadvantaged. They're all at-risk populations. Remember, the main focus on Healthy People 2020 is to promote health and prevent diseases nationally. So let's go to the poor, the elderly, ethnic minorities, economically disadvantaged. What type of foods is the cheapest food to buy? Okay, canned foods, white bread, okay, fast food. Okay, that's all pretty cheap. All right. So, and canned foods, they have a high sodium level. White bread, it's not the best. Refined flour and the sugar. Then we have the fast food, it's greasy. What type of diseases or health problems could occur? Hypertension, hypercholesterol, or hypercholesteremia. They could have a high lipid level, high cholesterol. They could get diabetes, obesity. So these clients, they are at-risk populations. So it's imperative that we look at these goals and the topics in Healthy People 2020 and figure out what is their plan? How are they going to make sure that they are able to help promote health and prevent the diseases? So before class, I'd like you to look up at this website here, healthypeople.gov, look at the objectives, okay? What's the goal? Why do we even care about it as nurses, okay? Why would you even care about it even as a student? Why? What are the objectives? And what interventions can you provide? All right, so here is your first question. So a nurse is caring for a 20-year-old client who is sexually active and has come to the health clinical for a first-time checkup. Which of the following interventions should the nurse perform first to determine the client's need for health promotion and disease prevention? 1. Measure vital signs. 2. Encourage HIV screening. 3. Determine risk factors. 4. Instruct the client to use condoms. What do you think? Okay, the answer is 3. The first action the nurse should take using the nursing process is assessment. So determining their risk. Okay, so that when you are to determine what risk factors, that is an assessment. You're asking questions, you're investigating for the answers. Okay, so question 2, I'm going to let you do. Okay, what do you think it is? So it's asking, the nurse is interviewing a client's medical record and reviewing immunization record. The nurse knows this is which prevention? 2, it's primary prevention. Yes, it addresses the needs of healthy clients to promote health and prevent diseases. So remember, the physical body is only one dimension of a person. What patients are thinking and feeling is equally important to their healing process. We look at these clients as a whole. A lot of times you can get focused in on that one problem, but these patients, we need to treat them as a whole. So that's called holistic. So we look at everything. So now let's talk about this part. Self-concept and sexuality. So first thing, what is self-concept? Why do we care about it? How does self-concept impact the patient's health and wellness? And how does sexuality play a role in the patient's health and wellness? These are topics that we're going to talk about in class next week. So start thinking about how you would answer this, and we will discuss in class.